Hi, I'm Chelsea Engstrom, and I have lived in Brookings for about 4 or 5 years with my husband, and I teach first graders at Hillcrest in town. So my husband and I welcomed our first child on December 3rd of this year, and his name is Jelmer Jack. I chose Brookings because, again, both my husband and I live here, and we both work in town, and we thought it's really simple to just go ahead and be able to drive right from work or right from our house down the road, and we don't need to go to Sioux Falls because all of the things that we need we can get right here in Brookings. My care was very excellent. I couldn't have asked for anything better, honestly. We worked really close with Dr. Abley, and she was very supportive and patient, and she answered every question that we could have ever imagined. So just very great care all around. So luckily, I didn't really have any complications. We're very grateful and blessed for that, my husband and I. And the only thing is I did get diagnosed with possible preeclampsia about month 7, which never really got to be anything major, but a minor complication was that. So I was diagnosed with preeclampsia because I had 2 indications or 2 symptoms of that. And the one was the protein in the urine, and then the other one was 1 high blood pressure reading. And I know there's things like swelling and vision changes and headaches and things like that, which I never had, but I know that I was monitored really closely for having those 2 symptoms. And what I understand is if things get worse, then women in birth can have possible seizures and things like that and complications. So that is what I think it is in my own words. So I had to get weekly ultrasounds. Dr. Abley suggested those because of the possible preeclampsia. And that way, if something were to happen with me or with my baby, then the ultrasound technician staff would be able to get us better care if something was the matter with my baby. Very bad. I felt like everything was going so smooth, and my husband and I prayed about things the whole pregnancy, like every night, every week. Then as the time went on and we had our next appointment, we realized that it's not that bad. You're just being monitored, and you have to go in so they can make sure you and your baby are safe. It's good to know that they want to watch this instead of just say, you'll probably be fine. Let's have you come in a month. I think it's better to be monitored weekly. So I felt good that they wanted to give me that care. They treated me very well. My husband came with every single time, and when he didn't come with once because of course he needed to do hunting and things like that, then my mom came in and they welcomed her really nicely too. And we had 2 or 3 staff members regularly, so we got to know them well with weekly appointments. They always welcomed us, and as just a regular person not knowing what's up on the screen, they were really explanatory to be able to indicate what this is and if everything is okay with the baby. So my husband and I, we didn't want to know the gender of our baby, and then going in every single week, we were kind of nervous because we're like, what if they accidentally misspoke and said he or she or something? But at the beginning of every ultrasound, they said, are you finding out the gender or not? If they didn't, we reminded them. And if it would come up where they scanned the baby's bladder, they'd say, okay, look away now. So we just felt really respected that way in our wishes. So just treated very well. I appreciated that it was right here in town. It was a 5-minute drive from my work or a 10-minute drive from our house, and everything that you need is right here in Brookings, so there was really no need to go elsewhere and take extra time from work or anything. So I just appreciated that everything you need is just right here and very convenient.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.